keeping my patient's health history in mind, and after performing the hand hygiene, I'll tell my patient to empty the bladder and put my patient in a supine position. Then I will expose the patient's area of the abdomen from nipple line below till the suprapubic area. Then I'll start with inspecting the abdomen, then auscultating, then percussing, and then palpating. I will look for in the abdomen if there is any scar, any striae, dilated vein. Use pen light if it's possible, and then look for any rashes or ecchymosis. Then I will try to look for symmetry in all 4 quadrants in the abdomen, and look for the contour of the abdomen. If it is, in this case, my patient's abdomen is flat. I can also look for protruded abdomen, scaphoid shape or round shape. Then I will also look for the umbilicus if it is bulging outwards, the contour of the umbilicus, any inflammation or any hernia. After that, I'll inspect for any pulsation in the epigastric area or any peristalsis in the epigastric area in case of thin individuals that can be visible. Now I will auscultate my patient's abdominal area, but before I do that, I will warm my stethoscope, the diaphragm, and the bell as well. In case of a patient who has atherosclerosis or hypertension, I will use the bell of my stethoscope to look for any bruit. First, I'll start my auscultation, dividing the quadrants of the abdomen. I'll start from right upper quadrant and go clockwise, and keep my diaphragm of the stethoscope in each quadrant for 5 to 15 seconds. I will listen for any gargling sound or any barbarrhythmias. If I do not hear any bowel sounds for 2 minutes, I will consider that as an absent bowel sound. Now I'm using the bell in the epigastric area to listen for any bruit which can indicate abdominal aortic aneurysm. Then I'll move to the femoral artery, and then also into the iliac arteries. And then I'll compare the both sides. After completing the auscultation, now I will percuss my patient's abdominal area. From the lungs, the percussion sound should be resonant, and due to the air-filled stomach and the bowel, the percussion sound will be tympanic. The liver spleen should sound dull on percussion. I'm percussing in all 4 quadrants and look for and listening for a sound that is tympanic. Then I will percuss in the liver area to find out the liver span. I will percuss from the mid-clavicular line. From the lungs below, I will start percussing, and until I hear from resonant to dull sound. While I come down, I will find the upper border of my liver span. Then from the same mid-clavicular line, I'll start from the navel area and start percussing upwards until I hear from tympanic to dullness. So from this area, from the top area of the liver to the bottom, I will measure this area with a scale in centimeters. For normal individual, it is between 5 to 12 centimeters. Then I will also percuss my patient's spleen to hear for dullness. If the spleen is enlarged, in the area of left lower anterior chest wall, will hear more dullness instead of tympanic when the when the spleen is enlarged. Now I will start palpating my patient's abdomen. I'll start with light palpation and then go for deep palpation. I'll palpate in all 4 quadrants and look for if the patient has any tenderness, masses, or resistance. I will also inspect my patient's face while I'm doing that to look for any signs of distress. Then I will do light palpation, deep palpation on the abdomen and look for any signs and symptoms of acute abdomen.